Morning everybody, I'm back here at the rather wonderful GAA ground of Nemo Rangers, and that's an intentional decision because I'm really aware of the pride that people have in their local GAA teams, and as you know, we've set the purpose of HSE South West that the people of Cork and Kerry will be proud of their health service. And so I'm here because we're running another set of cultural workshops with another 75 or so leaders from the health system in Cork and Kerry, really setting out those commitments that we have, those integrate commitments, and making sure that we hold ourselves accountable. Well, I've had my Living 360 appraisal from my boss, Bernard Gloucester, from members of the regional EMT and from others, and I'm really looking forward to us running that across all of our EMT members. So we hold ourselves accountable, you hold us to account, and then we're rolling those commitments down into the organisation, so all of us hold us to account for those really important commitments. So I'm really very proud to be working in the HSE in Ireland. I'm proud of the direction that we have from our political system, from our Taoiseach, from the Minister of Health, and I've been following some of the speeches from the Minister at the United Nations, and it really just shows how kind the people of Ireland are. And in that theme, we've had a gathering of kindness last week, and we were there at Cork University Hospital, at the St Mary's campus, and also University Hospital Kerry and Tralee. And there was really just an outpouring of kindness, and it was great to see that everybody in the health system really works in a kind way. Now, it's my job to make sure the health system itself is kind, and I'm very aware that for many people who are maybe feeling unwell at work or feeling stressed or pressurised, that maybe the system isn't kind. So I want to make sure that the health system in Cork and Kerry is what we might call institutionally kind. That is, one of the organising principles of the health system is kindness, and that we display that same kindness to the people that we serve. So whereas I see many individual acts of kindness to people all the time, whenever there's a person who's on a trolley waiting for admission to a hospital, or people waiting for an appointment for a long time, that's something I need to work on to make sure we stop those things from happening and make sure our system is kind. And many people have asked me for my thoughts about what's the difference between being nice and being kind. And maybe I illustrate that for some work that I did when I was in clinical practice. Quite often I'd have to break bad news to parents or families, and I could have been nice and said that everything's going to be fine. Well, actually, it wasn't going to be fine. Sometimes people had tumours, sometimes people had lifelong disability, and I needed to have a conversation to set out what the likely possibilities were rather than glossing over that. And in my work now, of course, I have to have difficult conversations with family groups, with patients, with staff. Sometimes I have to let staff know that they haven't been selected for a particular role, and I have to be quite clear about that. And again, it would be nice to say, well, don't worry, you came close, but sometimes I have to say, look, you just didn't meet the competence required at that level. And that's the difference between nice and being kind. Being nice, you say bland things. In being kind, sometimes you have to say things which require some effort and require commitment from you to say and do those things. Well, one of those things, of course, is we need the health system to work over 7 days. And so we'll be having some challenging conversations about how we require people to work over 7 days, not just the hospital consultants, but of course all the services supporting the entire flow through the health system. So the people who work in hospitals in diagnostic work, so the radiographers and others, the community teams, general practice. We need a whole system that works across 7 days. And so some challenging conversations designed around kindness to people who work in the system and the people we're privileged to serve. We'll be having those conversations very shortly. So once again, thank you so much to everybody who works in the health system for your kindness and for welcoming me into the community, and I very much look forward to come and seeing you where you are in your departments and other places you work very soon. Thank you.